In the previous lesson, we talked about psychoanalysis, psychodynamic therapy, and the most popular approach, which is a combination of all of the therapies. This is the eclectic approach. During this lesson, we'll continue learning about the other psychotherapies, which are humanistic, behavioral, and cognitive. And hopefully through the process of this short lesson, you will learn the following. What are the basic themes of humanistic therapy? How do behavioral therapy assumptions and techniques differ from those of psychodynamic and humanistic therapies? And what are the goals and techniques of cognitive therapies and cognitive behavioral therapy? The humanistic perspective has emphasized people's potential for self-fulfillment. Not surprisingly, humanistic therapies attempt to reduce the inner conflict that interfere with our natural development and growth. To achieve this goal, humanistic therapies try to give people new insights. But humanistic therapies differ from psychodynamic therapies in many other ways. So, humanistic therapies, they aim to improve psychological functioning by increasing a person's awareness of their underlying motives and defenses. So, the ways in which humanistic therapies differ from the psychodynamic therapies are as follows. First, they aim to boost people's self-fulfillment by helping them grow in self-awareness and self-acceptance. They focus on promoting growth, not curing illnesses. So those in therapy are called clients or just persons rather than patients. The path to growth is taking immediate responsibility for one's feelings and actions rather than uncovering causes. So we're not going to look at the past, what's underlying our past and our unconscious. We're going to talk about what's going on right now and accept responsibility for it and fix it. The conscious thoughts are more important than the unconscious. And the present and future are more important than the past. So this therapy focuses on exploring feelings as they occur, rather than gaining insight to the childhood origin of feelings. All these themes present in a widely used humanistic technique developed by Carl Rogers. This client-centered therapy, now often called person-centered therapy, focuses on a person's conscious self-perceptions. It is a non-directive therapist listens, without judging or interpreting, and refrains from directing the client towards certain insights. Rogers believed that most people already possess the resources for growth. He encouraged therapists to foster growth by exhibiting genuineness, acceptance, and empathy. By being genuine, therapists will express their true feelings. By being accepting, therapists may help clients feel freer and more open to change. By showing empathy, then by sensing and reflecting their clients' feelings, therapists can help clients experience a deeper self-understanding and self-acceptance. To Rogers, hearing was active listening. The therapist echoes, restates, and clarifies what the client expresses verbally or nonverbally. The therapist also acknowledges those expressed feelings. Active listening is now an accepted part of counseling practices in many schools, colleges, and clinics. Counselors listen attentively. They interrupt only to restate and confirm feelings, to accept what was said, or to check their understanding of something. So this is what they do to try to help the client understand that they care, they are empathetic, they're listening. Given a non-judgmental, grace-filled environment that provides unconditional positive regard, that's the purpose of this sort of therapy. People may accept even their worst traits and feel valued and whole. So unconditional positive regard is caring and accepting accepting non-judgmental attitude. This is something that Carl Rogers believed would help clients develop their own self-awareness and self-acceptance. how can we develop our own communication strengths by listening more attentively in our friendships? So Rogers gave 3 hints that might help. These are: summarize and check your understanding by repeating your friend's statements in your own words. Invite clarification. What might be an example of that? We may encourage your friend to say more. Reflecting feelings. It sounds frustrating, was what you could say. You might mirror what you're sensing from your friend's body language and emotional intensity. Now that sounds frustrating might be a way that you reflect their feelings. Behavioral therapies are what we'll be talking about next. These are a therapeutic approach that applies learning principles to the elimination of unwanted behaviors. They assume that problem behaviors are the problems. You can become aware of why you are highly anxious during exams and still be anxious. But by harnessing the power of learning principles, behavioral therapies offer clients useful tools for getting rid of unwanted behaviors. They view phobias, for example, as learned behaviors, so why not use conditioning techniques to replace them with new behaviors? One cluster of behavioral therapies draws on principles developed in Ivan Pavlov's conditioning experiences. As Pavlov and others showed, we learn various behaviors and emotions through classical conditioning. If we're attacked by a dog, we may thereafter have a conditioned fear or response when other dogs approach. And our fear generalizes and all dogs become the conditioned stimuli. Okay, so let's broaden the discussion here. What triggers your worst fear responses? Public speaking, flying, tight spaces? Whatever the trigger, do you think you could unlearn your fear response? With new conditioning, many people have. The fear of riding in an elevator, for example, is often a learned response to a stimuli of being confined in a tight space. Therapists have successfully counter-conditioned people with a fear of small places. They pair the trigger stimulus, which is the enclosed place of the elevator, with a new response, relaxation. These can coexist together. So the counter-conditioning is behavior therapy. It's a procedure that uses classical conditioning to try to create new responses to stimuli that usually trigger unwanted behaviors. So we have 2 different kinds that we're going to be talking about. There's exposure therapies and aversion therapies. So the exposure therapies, they vary in a variety of ways, the exposure and this systematic desensitization. These therapies they vary in a variety of ways. They try to change people's reactions by repeatedly exposing them to stimuli that triggers unwanted reaction. We all experience this process in everyday life. Why would someone who has moved into a new apartment be annoyed by loud traffic sounds nearby? But only for a while. That's because with repeat exposure, the person adapts. So this is also true with people who have fear reactions to specific events. If they're exposed repeatedly to that situation that once terrified them, they can learn to react less anxiously. So we have one form of exposure therapy that's widely used to treat phobias is systematic desensitization. You cannot be anxious and relaxed at the same time. Therefore, if you can repeatedly relax when facing anxiety-provoking stimuli, you can gradually eliminate your anxiety. The trick is to proceed gradually. Say you fear public speaking. A therapist might first ask you to make a list of situations that trigger your public speaking anxiety. Your list would range from situations that cause you to feel mildly anxious, maybe speaking up in a small group of friends, to those that provoke feelings of panic, having to address a large audience would be an example of that perhaps. Their therapist would then train in a progressive relaxation. You would learn to relax one muscle group after another. When you have achieved a state of comfortable, complete relaxation, the therapist will ask you to imagine with your eyes closed a mildly anxiety-arousing situation, perhaps a mental image of having coffee with a group of friends and trying to decide whether to speak up. You are told to signal by raising your finger if you feel any anxiety while imagining this scene. Seeing the signal, the therapist will instruct you to switch off the mental image and go back to deep relaxation. This imagined scene is repeatedly paired with relaxation until you have no trace of anxiety. The therapist will then move to the next item on your list, again using relaxation techniques to desensitize you in each imagined situation. After several sessions, you will move to an actual situation and practice what you had only imagined before. You will begin with a relatively easy task and gradually move to more anxiety-filled ones. So conquering your anxiety in an actual situation, not just in your imagination, will raise your self-confidence, and eventually you may even become a confident public speaker. If anxiety-arousing situation is too expensive, difficult, or embarrassing to recreate, the therapist may recommend what is called virtual reality exposure therapy. You would don head-mounted display unit that projects the three-dimensional virtual world in front of your eyes. The lifelike scenes, which shift as your head turns, would be tailored to your particular fear. Experimentally treated fears include flying, public speaking, particular animals, and heights. Those who fear flying can peer out a virtual window of a simulated plane. They feel the engine's vibration and hear it roar as the plane taxis down the runway and takes off. In control studies, people treated with virtual reality exposure therapy have experienced significant relief from real-life fear. Okay, so aversion conditioning. Aversion conditioning helps us learn what we should not do. It substitutes a negative, like aversion response, for a positive response to harmful stimulus. The procedure is simple. Form a new association between the unwanted behavior and the pleasant feelings. Is nail biting the problem? The therapist might suggest painting the fingernails with a yucky tasting nail polish. Is alcohol abuse the problem? The therapist may offer the client appealing drinks laced with a drug that produces severe nausea. If that therapy links alcohol with violent nausea, the person's reaction to the alcohol may change from positive to negative. So with aversion therapy, we have alcohol abuse has been used. Aversion therapy has used to try to help combat this. The therapist will give a person with a history of alcohol abuse a mixed drink containing alcohol and this drug that makes them sick. And after repeated treatments, some people develop at least a temporary conditioned aversion to alcohol. So operant conditioning. If you swim, you know fear. Through trial and error and instruction, you learn how to put your head underwater without suffocating, how to pull your body through the water, and how to dive safely. Operant conditioning shaped your swimming, and you're reinforced for safe, effective behaviors. And you are naturally punished as when you swallowed water for improper swimming behaviors. So remember a basic operant conditioning concept. Consequences drive our behaviors. Knowing this, therapists can practice behavioral modification. They reinforce behaviors they consider desirable, and they do not reinforce or even they punish sometimes undesirable behaviors. So using operant conditioning to solve specific behavioral problems has raised hope for some seemingly hopeless cases. So, operant conditioning, consequences drive our behaviors, behaviors that are desirable are reinforced, and undesirable behaviors are not reinforced and sometimes even punished. Like psychodynamic approaches, the cognitive therapies assume that our thinking colors our feelings. Between the event and our response lies the mind. Self-blaming, and overgeneralized explanations of bad events are often an important part of this vicious cycle of depression. If depressed, we may interpret a suggestion as criticism, disagreement as dislike, praise as flattery, friendliness as pity. Dwelling on such thoughts sustains our bad mood and may alienate others. So cognitive therapies aim to help people break out of depression's vicious cycle by adopting new ways of thinking. To change such negative self-talk, therapists teach people to alter their thinking in stressful situations. Sometimes it may be enough simply to say more positive things to yourself. Relax, the exam may be hard, but it will be hard for everyone else too. Or, I studied more than most people. Besides, I don't need a perfect score to get a good grade in the class. Training people to talk back to negative thoughts can be effective. With such training, depression-prone children and adolescents have shown a modestly reduced rate of future depression. So, cognitive therapies is the therapeutic approach that will teach people new, more adaptive ways of thinking, based on assumption that thoughts intervene between events and our emotional reactions. The trouble with most therapy is that it helps you feel better, but you don't get better. You have to back it up with action. This is something that Albert Ellis, a therapist, said. So cognitive behavioral therapy takes a double-barreled approach to depression and other disorders. This widely practiced, integrated approach aims not only to alter the way people think, but to also alter the way that they act. Like other cognitive therapies, it seeks to make people aware of their irrational negative thinking and to replace it with new ways of thinking. Like other behavioral therapies, it trains people to practice a more positive approach in everyday settings. So this is a very popular integrative therapy that combines the cognitive therapy with behavioral therapy, changing thought patterns as well as behaviors to try to help people with depression and other psychological disorders.